This is part of the series of interviews described by Elizabeth Kubler-Ross. As you know, Elizabeth Kubler-Ross, she's associated with DABDA, right? Kubler-Ross, DABDA, coping with death or severe illness, denial, anger, and then B is bargaining, and then depression, and then acceptance, and then the idea is, in general, people go through these stages. Of course, much more complicated than that, but it became very popular because people follow somewhat that pattern. And it became controversial when healthcare providers began to think that people have to be forced to go through all these stages. And of course, human beings and emotions and coping, it's not as simple as that, but it's very useful up until now. That's what we were told to memorize. But actually, Dr. Ross's contribution goes far beyond that. How did she come up with this? I mean, it's not like she thought about it. She looked at patients and then she thought, DABDA. I mean, it didn't happen that way. I mean, it's not like she just thought about it. What actually happened is she spent much of her life trying to interview people who are terminally ill, people facing severe illness, focused on people who are dying or who will die. What's impressive about this is she did it during the 1960s, during the time nobody would even care about doing that. Their entire professional life or career focusing on dying people. What's the 1960s? Technological, modern science and technology advances. So why is it so impressive? Because she did it during the time when nobody would even dare do that. First of all, people would look at you like you're crazy. You're focusing on dying people. When the entire medical community of the Western world, the developed countries were at the forefront of modern medicine, so optimistic and so focused on figuring out how to cure diseases because they're beginning to think that's what they were meant to do, especially physicians. Of course, at first, the nurses still held on to the idea that, it's not just curing, it's caring. Why? Because they're more in touch and they're seeing the patients all the time. I mean, they know that's not the case. The general practitioners also try to hold on. The ancestors of general medicine and family medicine and general pediatrics try to hold back because, they said that's not how it works. I mean, that's not all of it. That's just part of it. It's a nice part of it. If you can cure everything, they know experiencing disease is not all about giving them some cure to swallow or cutting them out to cure them. I mean, that's part of it. I mean, you're dealing with people. You're not dealing with machines, or you're not fixing a car, right? So that's actually her contribution. But anyway, it's Kubler-Ross, Death and Dying. Maybe we can remember the book she wrote. And these interviews are found in her book. More than likely, we memorize DABDA because they asked that in exams several times. This case that we're going to deal with concerns a 17-year-old teenager, an adolescent. Okay? She interviewed the adolescent in front of students. Now, she didn't say how many students there are, but the way she described it, she says the patient, the adolescent, asked to be interviewed in front of the students. So I'm guessing the context is she'd been seeing this adolescent a few times, and then she either asked permission, and the adolescent said yes, she'll be glad to, and she actually wants to, or the adolescent herself told her she'd want to speak to the students, or she asked this adolescent, do you want to share your story? And I think it will help the students. And then the adolescent or the teenager says, is that so? I really want to do that. Why she'd want to do that? That's an unusual answer, of course. We won't know because there's nothing that's written down saying which is which. She didn't write more details, but, the adolescent asked to be interviewed in front of the students. It's like several pages long. It's recorded and she didn't omit anything. So this is like the actual thing. So she knows that some of the questions are kind of iffy, but she didn't clean it up. You'll see some questions that hit the mark and some questions that didn't hit the mark. When you interview someone and you get excited, you think you know what the patient is saying, and then you say something it doesn't seem to actually hit the mark. That happens all the time, even in counseling. That's the reason why you have to focus not on yourself. I mean, the idea is not to guess it right all the time. The idea is to show the one in front of you are trying to understand, and to understand it in the best way you can. If you're heading in the wrong direction, I mean, it's a good thing you corrected yourself by trying to make sure that you're still both thinking the same way, right? Especially if you're doing client-centered counseling, which is very popular in the primary care fields, especially during the 1970s and 1980s. Right now, it's more like procedural interview. Like, ask this, say this, and do this. Because it's, the idea is to do the entire thing in 7 to 10 minutes per patient, which is not good. I mean, I don't think it's good, but that's the way the system is set up right now. Hopefully it changes, but I'm not so sure it will happen because it's not commercially lucrative. And that's the problem with primary care medicine right now. So anyway, let's start with the story. I can imagine she was sitting down and there's a bunch of students, maybe 5, maybe I've seen 5, I've seen 12, I've seen 20. And she starts with, I'll make it easy on you, she tells the patient. And just tell me if you're feeling tired. This patient actually has aplastic anemia, so she tires easily. It's a blood problem, and you're anemic and weak, and her body aches, and it's a lot of severe body pains. And she's probably getting some medications to calm it down. If you're feeling tired and it's too much for you, just tell us, and then we'll stop the interview, she says. And then she asks the patient, when did it all start? And then the patient goes, well, it just came to me. And then she goes, she was doing an activity in church and she was feeling symptomatic. She was feeling weak, feeling chills, and then she got body pains. And this was a small town. The church minister, the church pastor called their family doctor. You don't just go straight to the hospital, especially in small towns. I mean, the hospitals are far from you, and the family doctor is just right there. It's probably a member of the church. So the pastor or the minister called the family doctor, and the family doctor examined her. She's probably having abdominal pains because the teenager recalls. The doctor says, oh, it's a false alarm. It's not the appendix. It's probably abdominal pain, probably feeling nauseated. And then she rested. And then she felt somewhat better. She attempted to go to school for a few weeks. And then it happened again, more severely. And this time, they had to take her to the hospital. And she described lengthily the needle pokes and the procedures done and the tests done. I'm guessing there's an IV. She described how painful it was. And it was uncomfortable. I mean, nobody, even adults, don't like needle pokes and tests. And, we do a lot of blood tests. Sometimes we forget how it feels. We actually don't think about how it feels, right? Maybe we should, especially if we're poking kids, how does it feel as far as the kid is concerned? How scary does it feel? I mean, even adults are scared, right? So she described it, and they told her that she was aplastic. So that's what she says. And then she was asked how she felt, and then she says, I really want to know what it really is. And she wanted to know because she was concerned. I mean, her activities, and she cannot do the stuff that she wants to do. She's a teenager. She's attending school. She sounds like she was a good kid, and she's very active in school. And as she told us, or as she related, she was very active in church, and she wanted to know what's happening. And of course, the reason why you want to know what's happening is because once you know what's happening, then the next step is trying to make it go away, or maybe the doctor can make it go away so that she can do whatever it is she's been doing before. Go back to normal, go back to how things were. Or the other reason why you want to know what it is because, feeling something and not knowing what it is very scary. That's another reason. Actually, the interview speaks for itself. I don't need to add a lot of commentaries to it. You get a lot of things just from the mouth of the adolescent. The way she answers is very clear. She thought about it, and she wasn't that scared. She's very confident, actually. Especially she agreed to the interview. Imagine a bunch of students in front of you, and you have an aplastic. She actually knows that it's terminal during that interview, and she's answering really well. Of course, I don't know how many times Kubler-Ross had interviewed this kid before she faced the students, and how many times Kubler-Ross's question was asked before, but we get a lot of stuff from the way she answered. And then the doctor, Kubler-Ross asked her, well, did they tell you? Meaning, did the doctors and the nurses tell you? Or, of course, the nurses won't say if the doctor won't say. What did the doctors tell you? Nobody can forget this. I mean, she's really worried and she wanted to know. So she can remember clearly the answer to her question. And the doctor said, it's not terrible. Don't worry, it's not bad. And then she asked, what's causing it? We don't know what caused it. And that's it. They said, it's not terrible. We don't know what caused it. So it's not bad, don't worry. And then what caused it? What's causing it? We don't know what caused it. And then that's it. Kubler-Ross, actually Kubler-Ross asked a very specific question. She's trying to, she's teaching the students. So they told you that it's not terrible. Because obviously that's a lie. I mean, aplastic anemia during that time is a death sentence. It's a terminal illness. And then the teenager, she knows what Kubler-Ross was saying. I mean, they probably talked about this before. And then the teenager says, they told my parents, and my parents asked me if I wanted to know, and I said yes. And my parents told me that I'm aplastic and I'm terminal. And then Kubler-Ross asks, how do you take it? He says, if it was God's purpose that I got sick, then he'll take care of me. I just have to keep on going. It happened so suddenly, probably it's God's purpose. Meaning, it's an unusual thing, as far as she's concerned. Of course, we're the nurses and doctors looking at her case right now. Even us, we know, well, it always happens suddenly, most of the time. I mean, aplastic anemia, it's not the kind of thing you scream, right? And so you start feeling bad, and then at first we think it's nothing. It's a very classic kind of story that she gave, and then suddenly she gets worse, and then we do a bunch of workup, and then we tell that person that they have aplastic anemia. And if it was the 1960s, it's a really bad diagnosis, and they'll die because of it. Now, as far as the patient is concerned, as far as the teenager is concerned, she was living a very normal life. She was very active in church, and she's going to school, and she's a perfectly normal, happy, very sociable teenager, and it happened suddenly. And she's saying, if it's such a sudden thing, then maybe it's God's purpose, meaning it's God's will. We don't use God's purpose right now, but, it's God's will. It's what we would usually say. But her term, it's God's purpose. And if it's God's purpose, then I just have to accept it and go on with my life. Now, she already knows that she's terminal. Now, the students get to ask questions. So the first question is, did you ever feel sad? Did you ever feel depressed? Did you ever feel depressed? Of course, that's a natural question. We're looking at this teenager and we're trying to empathize. We're trying to imagine, we're the student, we're around her, and we're the trainees or residents, and we're trying to figure out how would an adolescent feel like. You're in school, you're happy, you're going to church, you have your life ahead of you, you have dreams, you're planning your future work or family and things like that. And suddenly it won't happen anymore because you have aplastic anemia and you're terminal and you'll die. And so the question is, are you feeling depressed or did you feel depressed? The question was, did you feel depressed? Because right now they're looking at her and she probably didn't look depressed. Of course, I mean, we're reading through the transcript, and the problem with the transcripts is we don't see half of the exchange. What's half of the exchange? The nonverbals. We're not seeing the body language, the pauses, the facial expression of the students and the doctor. And so we're not seeing that. But something made the student say, did you feel depressed? Because she doesn't look depressed right now. And the teenager says no. If it's God's purpose, if it's God's will. So, and then the next question is, do you think others might feel depressed and sad? That's the follow-up question. I mean, it's such an unusual answer, so kind of, disorients. I mean, if you're the student, you'll get disoriented. How can you not get depressed? So, do you feel like others might feel depressed? Or maybe she's in denial. So, do you feel others might get depressed in your situation? And then she answers, well, your feelings sick and weak and painful over. And I guess pretty much, and in so many words, that's how it sounded. And then the next question is, would you wish sometimes that your parents weren't the one who told you, but instead the doctors told you? And then she goes, no, I like my parents to tell me better. That's the first answer. So that carries a lot of weight. I mean, that's the first thing that came to her mind. And then she follows it up with, well, I guess it will be all right if they told me. It would be fun. I don't know what she meant, but that's what she said. So I'm guessing it will be fun because, the doctor will be sitting down and then telling her the diagnosis. She can ask questions about it, or maybe she's that emotionally stable. But that's what she said. I'd like my parents to tell me better, but maybe they, physicians, can tell me. Maybe it was right for them to tell me, and it will be fun. Probably, we talked about it, and Kubler-Ross was trying to um, push the point that doctors should be communicating more with their patient. That's the reason why she said that. They had previous talks, or it actually made sense. It makes a lot of sense. It's just something that doesn't happen all the time during their time, especially right now. If it was happening then, it's probably happening now. It's a teenager. You don't even need to talk to the teenager if you're just worried about getting consent signed and patients filled up so you can do your treatment, right? So it takes a lot of time, and you'll be exposed to a whole bunch of emotions. There's no guarantee that the teenager you're treating would be as calm as this particular teenager, right? So anyway, that's her answer. Now, another student pressed on with a very specific question. The people around you, the people in the hospital, the doctors, the residents, the trainees, the nurses, have they been avoiding the issue? This is a student asking. Obviously, they're not aiming for like the counseling open-ended question. It's a point that we thought about. And that's how, if I was a student and very excited and I thought about the idea, I want to show everyone I thought about it, and I'll probably ask the same question. It's good if you hit the mark. It's not good if it's too far off the mark, right? But this time the student hit the mark because the patient says, they never tell me anything. Well, they never tell me anything. Well, it's mostly my parents, and then my parents tell me. Now, another student is trying to figure out how she's feeling and then asks, have you felt different? Have you changed? Are you feeling different? Now that you know that you're aplastic and you have a terminal illness. And then a patient in so many words says, no, I feel the same. It's difficult being in the hospital, and I went through a lot of symptoms and the pain and the tests and the blood draws, but I'm okay. I'm feeling the same. It hasn't changed me. Right? That's the answer. And the student picked up on the first part. She was very active in church, and then she actually says, if it was God's will, if it was God's purpose, then I'm okay with it. And so, the obvious question would be, do you think your faith helped you? Or, this is what the student asked, did you get more faith during this time? Did your faith become stronger during this time? And then again, the student's question hit the mark. She says yes. And then they're trying to figure out if she's aiming for, a cure or a miracle. And then and then she answers, well, I don't know, because the doctors say I won't pull through. Meaning the doctors told the parents, and the parents told her that she'll die. Okay. And then she says, but if it's his purpose, if it's his will that I pull through, get cured, then it will happen. So, meaning, in her mind, the doctors are saying she won't get better, but that's not all of it. The doctors are saying what they can do and what they know, and that's not everything. And if God's going to make her better, then she'll get better. Which is pretty much really basic Judeo-Christian, Christian or Catholic belief. Right? And if the doctor says no, it's not like the Holy Spirit told the doctor to tell you that it's not going to do anything. It doesn't work that way. Now, of course, a lot of the doctors don't believe that anymore, especially if you're in a very secularized country, or at least a metropolitan area of that place, that community, or an institution that's very secular, westernized secular. Then most likely the person or the provider or the doctor or the professional that you're speaking to doesn't even believe in God the way you do, and believe in miraculous cures the way you do, right? Or maybe they'll pay it lip service, but that's pretty much all there is to it. That's their belief. That's not part of medical school training, right? So anyway, she says, that's what they think. But if it's God's will, then I'll get cured. But she's still hoping for a cure. Has your personality changed? Or have you changed? I mean, this illness had changed you. And then she says, yes, in a way, because I'm sociable, but now I'm more sociable. I talk to my friends and my classmates, and I'm closer to my brother. I get along with more people. I go around, visit the patients, make them feel better. She's in the hospital, so she's in the adolescent ward, so she talks to patients probably her age, and not a lot of teenagers would do that. So she's fairly strong, and she's feeling stable, and she's trying to keep their emotions up. And she says it also helps her. She feels better. She's talking to a lot of to the patients, knowing that she's making them feel better. And then and somebody asked, "Have you seen any changes in your family?" And then she says, yes, it affected my family. In so many words, she says they're much closer. They talk to each other. She talked about her siblings, how close she got with her brother and her sister. So she describes how closer she got, how much closer they are in the family right now. She's been close to her brother and her sister, but now they're more close. Actually, she says everyone got close. Even her siblings became closer to her parents. They're talking more. They're supporting each other. And pretty much what she's describing is what you would want a family to do. In times of crisis, what you would want is everyone supporting each other. So, of course, you get closer. There's this big, huge crisis attacking your family, and one member is very sick, and one member might die. Try to support each other. What you don't want happening is the family members not supporting each other. And right now, especially in countries where the family as a unit kind of is crumbling, all sorts of reasons. We won't go into that. In developed or newly developed countries, there's lots of reasons, like fathers in the Middle East working, or the mother left her job as a teacher to work as a domestic helper in some country to send more money because she earns more money. They're just talking by cell phone every now and then, or the dad has like 3 families because it's the culture in that place, and things like that. When the unit's not that strong, then you have more trouble. But this family is strong. That's probably the reason why the patient's very stable. She's not very harassed or stressed. And then the student asks, did it deepen your relationship with your parents? Yes, and not only her siblings' relationship with her parents deepened. And the student asks, do you have a sense of support coming from your family? Logical question. And then it hit the mark. The patient says, I don't think I can get through this well if it wasn't for my friends and family's support. And support from family and friends are very important as far as coping is concerned. Now, you take that away for various reasons, like the patient has to go from the province to the hospital and everyone's in the province. That's one. Or, the patient's in the hospital and you only allow one family member to be there, or they cannot afford to send everyone near the patient because everyone has to work there. They're not that rich, or they cannot afford to live in the city because it's very expensive. And buying the food and staying there and not working for 1 or 2 days is a big deal, especially if they're not that rich. And there's all sorts of reasons why there won't be any social support, right? Now, friends in school, obviously, that's much more difficult. I mean, they're still attending school and you're in the hospital. It's harder to do. Right now, it's easier. During that time, this is 1960s. They don't have the cell phones, the smartphones where you can talk to your friends. Right now, it's a lot easier. Probably it's a good thing to encourage that. Again, the bottom line is social support is important. And then the student asks, do you feel kind of depressed when you're alone? Probably it's because her first answer was she wasn't feeling depressed at all. Somebody felt like she has to figure this out. If you're alone, do you feel depressed? And actually the patient said yes. So I guess one take-home point is just because she asked a question, like, do you feel depressed? And the patient says no, you stop there. Trying to understand the patient, trying to empathize and understand the patient, trying to get to know your patient well. It's not just a matter of reciting one question. Do you feel depressed? No. Okay. She says no. Then go on with the story. I mean, you don't do that. Imagine you talking to your parents. Do you always answer that clearly and that honestly the first time they ask you? No, of course not. Now you're talking to a teenager and you're not even her family, right? Well, anyway, do you feel depressed when you're alone? And then it hit the mark. It said, yes, I panic, I get worried, I get anxious if I'm alone. And that's probably a very normal reaction if you know that you might die and you're not feeling well. Of course, there's not a lot of information they told you. Probably nobody gave her like prognosis, like you won't die right now, you'll die in 4 to 6 months, most of the time based on nobody told her that. Her parents probably just told her, you're aplastic and you're terminal. So every time she's alone, you get worried. There's no social support and you're feeling your body, you're feeling weak, and it's nighttime, it's dark, and you don't know what will happen to you. You might not even know whether you'll still be alive in the morning or something bad will happen to you tonight. So you get scared, you get panicky, and you get depressed because if you're alone with nobody to talk to, you're not going around talking to the other people feeling good because you're making them feel better, then you're all alone dealing with your emotions, thinking about yourself and your illness, and of course you can get worried and you can get sad, maybe even depressed. Especially for teenagers, she actually shared that she's the kind of teenager who's very sociable. She's always around with friends, and this is the first time she's been alone in the hospital, knowing that she's sick. Something to think about. If you're dealing with kids, teenagers, and even young adults, even old adults, their entire lives, they've been feeling well, and this thing never crossed their mind, and suddenly they're in the hospital, and somebody just told them that they're very sick and they might die. This is exactly how it would feel like for most of them. And then the student asked, don't you wish that your parents didn't tell you right away? Her answer was no. I'm glad they told me. That would go along with her first answer. So her first answer, she was concerned. She doesn't know what's happening. Her life has been altered by this pain, this illness. It's not a universal thing. Some people might have answered, I wish you didn't tell me. This girl said, I feel better. I know what's happening to me. Of course, her other answer also helped out. If it's God's will, I'm okay with it. Whatever His will is, I accept. And then one student asked an unusual question because this is not the kind of question many would ask right now. She went for a very spiritual, very religious question. The student goes, what's your vision of what happens after death? Or what's your vision of death? And then the teenager starts describing what she expects during death or after death. Well, she says, I think death is wonderful because you go to your real home, which is in heaven with God. It's a kind of reunion with the people you love, and there's no sickness, there's no suffering, and you don't need to eat food because you're being sustained by God, and everything just feels right. If I ask most of you, if you get asked and you have the Christian or Catholic belief system, that's pretty much your basic answer, right? Everything's perfect, everything's good, you're with God. God is like the source of all goodness. That's your actual home. That's what you aim to go to. And that should be your answer. Now, of course, you go through med school and then you get exposed to a very secular, non-God, non-religious, whatever religion is a non-religious thing. Definitely not Christian, non-Catholic, very westernized and very secular. And then you get confused. You're working with two belief systems and at first you don't realize that you are. Maybe even through the early part of your professional life. Hopefully not. Hopefully you recognize you're moving from one belief system to another. You go to the university, you think this way. You go to church, you're supposed to think this way. And then just be aware when you go through the university system, there's a difference between secular and religion. And when you talk about terminal illness, death and dying, and when you talk about the patient's belief system, you're dealing with all these things. You have to be aware. If you're trying to understand your patient, be aware that they might not share your secular belief. If you're going to church and trying to do all these stuff, be aware that the stuff you think about and the stuff you want to believe in might not be in line with the stuff or with the philosophical ideas that you're absorbing in the university. Hopefully that's not the case. I mean, maybe you're in a good university, but be aware of that. And then the doctor asks a very revealing question. The doctor says, do you think the doctor should be telling the patients or communicating to our patients better? If it was your mission to teach us, of course, this is in front of the students. If it was your mission to teach us, doctors, what would you teach us? Now, the other thing she said before this question happened, she actually described her parents. Her parents are missionaries. They do mission work. And that would explain a lot why she thinks that way and why her parents are also strong. Actually, her mom gets interviewed after this interview, but we won't talk about that right now. And so the question is in line with that. I mean, that's the reason why she's also doing her mini mission work, moving around the hospital, trying to talk to the sick people or the sick kids, and probably sharing her belief and trying to strengthen them. And this is the 1960s. There's no such thing as a nurse or a doctor telling her, you don't do that, we're secular. Don't go around each patient telling them Christian stuff. I mean, there's no such thing during that time. Right now, it's actually happening in some places, especially in very, very secularized communities, unfortunately. But during that time, I mean, she's probably doing her mini mission work. And Kubler-Ross noticed this, probably why she asked this teenager if she wants to get interviewed in front of the students to teach them this lesson, how important it is for doctors to talk to their patients. Remember, this is a teenager. She knows she's sick. There's no reason. There's no reason for her to lie. Right? And she asked for this, and she wanted to teach the young students something before she dies, right? If it's God's will. And she says, the doctors, they come in and look you over and tell you, how are you today? Or something like that. And they're real phony. Just kind of makes you resent being sick because they never really talk to you. Or they come in like a different kind of people. Most of the ones that I know do that. Well, they come down and talk to you. Or they come in like they are a different kind of people. Of course, I don't know what that means, but that's exactly how she said it. Most of the ones that I know do that. They come down, they talk with me for a little while and ask me how am I feeling and visit with me. So that's when they do rounds. Say things about my hair, that my hair is good or I'm looking better. They just talk to you and they'll ask you how you feel. It's kind of hard for them because I'm underage and they aren't supposed to tell me anything. I think that's so important to talk to a patient because there's a cold feeling between the doctors. You kind of dread to have them come in if it's going to be cold and businesslike. So she actually dreads the visit. And even if you do like, oh, how are you doing? You're looking better. How's your hair? I'm trying to look friendly. Well, she says, in some way she says, it's phony. She'd rather not have it because they look cool. They look businesslike. She feels like she's not that important. And they don't really talk to you. I mean, they talk to you, but she feels like that's not really talking. It's just like small talk. And you resent being sick. It seems like they're not talking about the things that's very important right now to you. And you feel like you're not that important. You're talking to your parents, but you're the one who's sick. Of course, we're not doing it ourselves most of the time, right? Especially if you're busy in a very busy training center and nobody asks you, did you talk to the teenager? Aside from getting the consent from the parents, nobody really checks on that. Or they check and then they say a small thing like, yeah, I talked to her and I told her her hair was nice, and the consultant would probably say, very good, very good. But, that's not gonna work. Especially right now. A pre-adolescent and teenager will see right through you. If that's what you're going to do, you're better off not doing it. Because they feel bad. I mean, this person felt bad. Very cold. It's very businesslike. The nurses would feel good about her answer because she says, the nurses are better. They actually talk to me. And maybe because they spend more time with me. So the nurses spend more time with her. They're more caring. They really talk to her, unlike the doctors. And then her actual words are, because they are here more, and they actually do more than the doctors. Of course, if you're a doctor, you go. Some of you might say, well, we're the ones writing the orders. Everything the nurses are doing, we thought about it, and we're doing a lot of things. But, this is a teenager. She's not lying. As far as she's concerned, she's lying down there, and most of the time, the doctors do the round, few minutes. Maybe the good ones would spend about 15 or more, maybe 15 minutes or 20 minutes, but most of them will just do your hair looks nice, how are you doing, and the phony cold thing. That's it. Of course, they don't see doctors writing in the chart and the long orders and things like that. And even if they do, as far as they're concerned, the ones really taking care of them, if they're feeling sick, asking them how they're doing, checking on their blood pressure, asking them if they feel good, how's the food, and taking care of them all throughout the day would be the nurses. So it would make sense for the patient to say, they're doing more and they're here all the time. What's the take-home point? If you cut your visit too short and you don't do a lot of things in front of the patient, that's how your patients will feel like. And that's not good. Of course, we can come up with excuses like that's the way the system is set up, but that's still how your patients will feel. That's the way the system is set up. It's not an excuse and will not change how your patients feel, right? So if that's really how the system is set up, then you probably should try to change the system, right? So if you're really concerned about caring for patients, if that's your strongest motivation when you decided to become a doctor or a nurse, right? And then there's actually a few paragraphs talking about asking her if she's experienced a death, and in so many words, the answer was she hasn't really experienced a lot of deaths. Just one, a close uncle of hers, but that's about it. Her grandparents died, but she's very small. She can't really remember it. But that's it. So really the question is, you're trying to figure out whether she's experienced death up close, and this made her stronger. In a way, the patient actually said later on that the uncle who died was her favorite uncle. And then she again says, you don't really have to cry when somebody dies because they go to heaven. When her close favorite uncle died, that's how she thought. The same thing that she's thinking right now when she's facing death. So it's a take-home point. As far as a lot of people are concerned, when they're facing terminal illness, death and dying, a lot of them would be comforted by their spiritual or religious belief. The way they view death, the way they view suffering, would be based on their belief about death and suffering. Okay? Now, this is the 1960s United States, America of the 1960s. I mean, 1960s is still at the height of the Christian, evangelical, and even Catholic movement. So this is a fairly common answer. Right now, I mean, even in other countries, but right now, that's becoming less and less and less. We decided that religion and spirituality has no place in the educational system, and those things are bad. So now we have students being exposed to that and growing up, or teenagers growing up with the belief that there might not be any God or heaven and things like that, and they get sick, or even adults who get sick, and there's no strong spiritual belief system that props them up. If it's secular and materialistic, you die and that's the end of your story. That's pretty much the end of it. That's not very comforting, right? Anyway, that's not the topic right now, but that's why this patient is different. These kinds of answers are getting more and more rare nowadays. Sometimes the hospital environment is also going to support that. If there's some religious or spiritual belief left that could have propped up a patient right now, being exposed to the attitudes of everyone in the hospital, that probably will dissipate. Because nobody's saying that there's such a thing. Most of the time, if you're in a very secular hospital or university medical center, right? So we won't go there. So that's the end of the interview. Actually, the interview ends with the doctor giving the final word. And the final word is, so what you're saying is for us doctors to be a little bit more understanding and to take some time to talk with our patients. So that's what she said. and it ends.